pick back up. I want to introduce Dr. Jojo Yang. Dr. Yang, she's the chief resident in pediatric neurology at Stanford, and she's completing a fellowship in pediatric epilepsy at Stanford over the next academic year. She's interested in medical education at the resident level and the health advocacy for patients. Her research interests are rooted in genetic causes of early life epilepsies and gene therapies. So welcome, Dr. Yang. Thank you.
Okay, good morning, everyone. Thanks for coming back from your break to join me for this. People often ask me, what does the chief resident do exactly? And I reference Grey's Anatomy. You guys remember Bailey, the character from Grey's Anatomy? I'm like, basically I get to tell the other residents what to do. So I'm here on behalf of my lovely team of mentors. So the first person up there is Dr. Porter, who is with us in spirit today because she's back home reading EEGs right now. And then Dr. Emily Spellbrink, who is also an epilepsy specialist at Stanford, and we three are working on this project. Dr. Maura Ruzhnikov and Elise Brimble are our neurogenomics team. So they are the ones that all of our patients who get genetic testing get referred to interpret those tests. And Maura has been really wonderful and working with us as well. She trained at UCSF. And Dr. Porter has ties to WashU St. Louis as well. She went to medical school here. And Elise Brimble is our genetic counselor. I am here today because of our work with a different type of genetic mutation called SLC13A5. SLC13A5 is the name of the gene that causes it is in a sodium-linked citrate transporter, which is on the cell membrane of neurons. So similar to GNAO1, which is a G protein coupled receptor on the cell membranes of neurons, this is a sodium-linked citrate transporter, meaning it moves citrate in and out of the cells. This picture is the Nye family. They're patients of ours at Stanford, and on the right is Tessa, and the left is Colton, and their parents. They formed a similar family foundation called the Tess Research Foundation, and have been working with us on this. SLC13A5 deficiency, basically you can't transport the citrate into the brain, and so you have a deficiency of citrate. And they have a really similar phenotype with epilepsy that starts in infancy, developmental delays, hypotonia, movement disorder, and tooth enamel or pitting problems. And we really, as Dr. Vihor mentioned, there's a lot of genetic mutations that can cause epilepsy plus movement disorders. But because these are both sort of similar in that they're a very specific protein and on the cell membrane, we thought about comparing them. So the study questions in my discussion with my mentors was, what is the gene mutation's influence on a child's daily life? And is there a measurement scale that we can validate and use to track progress in future clinical trials? So what the question from this table over in the corner to Dr. Newbig about that study that your children came for in Michigan, this is kind of trying to answer that question of what can we use when we do get to our clinical trials soon. So we reviewed the literature and discussed with our colleagues in development and behavior pediatrics, and what we ended up deciding on was trying this behavioral scale called the Vineland-3. It's an adaptive behavior scale, and the test is administered online, and it's validated for anywhere from birth to age 99. The company is Pearson. They do a lot of online testing, like the GRE and SATs, I think. And the parents are able to do it at home. And the goal with this is that it is hopefully a measure of your true function in daily life with specific questions about your child's gross motor and fine motor skills, social skills, communication skills, and daily living, kind of like brushing your teeth, etc. And this scale was studied in Dravet syndrome and then published in 2014 as a validated scale. And for those of you not familiar with Dravet's, it's a severe type of epilepsy with also onset in infancy. So the way we've designed the study is that we're doing a REDCap questionnaire, which many of you might be familiar with, is that it's a secure online questionnaire database. There's questions for parents about seizure types and medications, and specifically what has worked for epilepsy and movement disorder. And I understand there's probably some overlap with other work that Dr. Vihover has done. And then the second part of it is doing the Vineland-3 questionnaire online on the Pearson website. And our goal is to repeat this in 6 months to see if there's a change. So my presentation is pretty short and sweet. The next part, I just wanted to kind of show you guys what it looks like so that hopefully if you do go online and participate in this study, you know a little bit about what to expect. So the website, the short link is up there. It's is.gd/Stanford Epilepsy Behavior Study. And the first page is the consent form. You basically go through and at the bottom hit submit for consenting yes. And then the next part is that initial survey about, this is on the REDCap website, and it just takes information on when your child's seizure started and what kinds of medications have worked, and also about movement disorders a little bit. And then just a quick note that, can you raise your hands if you have 2 or more children with the GNAO1 mutation? Okay, thank you. So in SLC 13A5, there are several families that do have 2 or more children with the mutation, so that's why we included that, so you would do it for each patient, for each child that you had. And then after that, you would get an email from me through the Pearson website with a link to the website to do the Vineland questionnaire. And it does expire after 30 days, so just please be aware that if you do get the email that you would need to do it within 30 days. And this is just an example of what the website looks like, and it's pretty straightforward to navigate. The questions are a little bit tricky. You kind of have to read them a little bit carefully. And the website does learn, if for example, if you're answering no repeatedly, my child can't do that, then it would skip certain questions. And so this is a rock sculpture near the Art Museum at Stanford on campus. It's called Stone River. And I just wanted to put this in there as a moment of gratitude that you guys could all take for yourselves for being here, and noticing that there is the light and the dark, and that you guys have all traveled, or many of you have traveled from far away to be here. So I'm incredibly grateful for that, and for the inspiration that you and your children provide for us to do this research. And that's it. So thank you. This is my email if you have any questions, also my cell phone. It's Dr. Porter, Dr. Spellbrink, and me on Valentine's Day, where we all happen to be wearing red, and the study website.